Hello again and welcome to the conversation. Thank you for joining me. I'm Ryan Campbell. We're joined today by two very special guests. We have Kim Freeman, you're the Tuolumne County's Public Health Officer, and we also have Cassandra Jenecke, Tuolumne County District Attorney. Welcome and thank you very much for being here.
Thanks
Thank
for
you.
having us.
Yeah. I wanted to talk to you kind of right off the bat about opioids. So it's a problem that kind of touches both of your areas of expertise. And it's something that you gave a presentation to the Board of Supervisors about opioids and opioid addiction in our county a few weeks ago. Could you tell me a little bit? I guess I'll start with you, Dr. Freeman. Where does Tuolumne County stand in terms of opioid addiction? My guess is we struggle with it.
We struggle. There are many ways to look at addiction as far as statistics go, not all of which are perfect. One of the statistics that we do have that are pretty accurate because we know what pharmacies are dispensing is how much is prescribed in our county. And we are the worst in the state for morphine milligram equivalents prescribed per resident.
Hmm.
I have had that wonderful distinction for 6 years now.
Hmm.
The exciting news is that we are improving that number. For instance, the new 2022 data just came out. We are now about 698 morphine milligram equivalents per resident. We had been around 800 in 2021. So a significant amount of improvement, even though we're still number one in that realm. We are bad for things like opioid co-prescriptions. For instance, it's dangerous to prescribe more than one type of opioid to a person. We're also bad for opioid and benzo co-prescriptions. Again, that increases the risk of overdose deaths. And just for information, morphine milligram equivalent is the way to equilibrate a opioid product. For instance, a Norco 10 is worth 10 morphine milligram equivalents and a Percocet 10 is worth 15. So it helps us know how much is really out there and being dispensed by the pharmacies to our residents.
Yeah. And it seems like there's so many different types of opiates and opioids, and there's a distinction there, uh, but they all pretty much do the same thing. Is that correct? Like, why are there so many different types of opiates and opioids available? Why isn't there just morphine?
Oh gosh, that's a great question. I think that has to do with capitalism in our country. Uh,
Oh, interesting. I didn't know it was a deeper question. That's
but I mean,
what
there's
really, why are there? I mean, is it like a marketing gimmick, or are there some that are slower release than others?
they do have different properties. They can be slower release, where you may take something twice a day to achieve the same result as something that you would
Hmm.
take every 4 to 6 hours. So the amount of opioid in something, how frequent you might want to take it or might be prescribed to take it, can differ between them. The addictive properties are allegedly a little different. However, all of them are addictive. One of the medications that's out there for morphine or medicated assisted treatment is buprenorphine. So it is safer in the sense that it will not depress the respiratory drive. So it's being used more for pain and for opiate use disorder and helping people get off of the dangerous opiates. So it's got different properties which are really unique and fantastic about it to help achieve pain control and uh, control withdrawal for people who are trying to get off of traditional opioids. But the other ones, they all are for controlling pain. They all have GI side effects. They all create euphoria,
Hmm.
and all are addictive.
Hmm. And I wanted to ask you, District Attorney Jenecke, about so th- there's a medical reason why opioids exist, and they have a purpose, but it seems like the it turns into a law enforcement issue whenever you have any kind of strong addictive substance. If you and it goes very far back into history. You had heroin addiction in like the 70s and the early 80s, and that morphed into cocaine and crack addiction in the late 80s, early 90s, and then in the late 90s, early 2000s, you have methamphetamine, and then that segued into opioid addiction, and we've just never been free of any kind of addictive substance. And how do you fight that, and how do you combat that from a law enforcement perspective?
It's a good question. I think it's really difficult for us to contemplate how we combat the ability of human beings to become addictive. I mean, I sat through one of Kim's presentations and was really shocked at how she explained what addiction does to the human body. So an individual that's engaging in the illicit market for whatever drug that they're seeking, they're just seeking dopamine.
Mm-hmm.
And to understand that they literally need the drug that they are seeking in order to produce a hormone that we need in order to be motivated to get out of bed in the morning is a very different understanding of addiction than I think the criminal justice system is capable of providing. You know, we try to be focused on eliminating the illicit market to the extent that we can, and what efforts we can do to hold dealers accountable, to ensure that the illicit substances aren't getting into the wrong hands. And so it's very difficult, and it's particularly difficult for us in Tuolumne County.
What, and I'm putting you on the spot here, what percentage of the crime that occurs in Tuolumne County would you say is connected to opioids or some other type of addictive substance?
I don't know that I could give you a percentage. What I can tell you is that over the last several years, I've had the opportunity to actively file some of our misdemeanor cases. And what I will tell you is that the majority of our misdemeanor drug-related arrests are opiate-related. It's either going to be heroin or it's going to be fentanyl in particular for us. And so when we take that into consideration and we think about the stranglehold that opiates have on the Tuolumne County illicit market, it's very significant for us.
Mm-hmm. And you mentioned fentanyl, Dr. Freeman. I wanted to ask you specifically about that. That's kind of the big buzzword that people talk about now is fentanyl addiction and how dangerous it is. What is fentanyl? Is it different than any other opioid? Why is it so? It seems to be so much more dangerous and deadly and more common than it ever was in the past. Can you tell me a little bit about what it is and how it affects people?
Fentanyl is an opioid, like the others. However, it is much, much, much stronger.
Hmm.
So it can be manufactured as a synthetic opioid. So it doesn't require the opium plant
Mhm.
to make it. So anybody can make it if they know the chemistry. So that creates a market of chemists, if you will,
Yeah.
that would like to sell it and get people addicted. It's very addictive, much more so than some of the others. So people seek it. It creates a very quick high as opposed to some of the others, which are a little slower. So again, that creates addiction in people who seek that. But the biggest problem with it is it's so strong that it is less than a grain of rice is the amount that is required to kill someone.
Mhm.
Or 3 grains of salt is another way it's been described as the amount needed to kill someone.
Yeah.
So the illicits who are making it, they're pressing pills and they're putting other additives in it, and they're making it look like a regular pill. However, the concentration isn't the same in a piece of the pill versus all the pills. So in a 10, you might have one that's deadly and others that hardly cause any kind of effect. So the consumers of these are putting themselves at risk in buying these pills
Uh-huh.
because they don't really know what they're getting.
Right. Yeah, and I'm hearing it's ending up in everything. It's ending up in all types of drugs. Some, I don't know all the different names of drugs and different things, but that people are purchasing drugs that they're not intending on purchasing opioids, but it's being put in there to give it more of a stronger effect.
Correct.
And, obviously the people that are doing this don't have a degree in medicine, and if they get it wrong, you're getting a major dose of fentanyl.
So yeah, it's being found in marijuana, in methamphetamine, cocaine. Those are all being mixed with it. And the thought is the dealers are trying to create more addiction in their consumers so that they
That's
come back
terrible.
and purchase more from them.
Wow. So it's not about creating a better product. It's about just getting you hooked.
Yeah, I mean, some consumers are seeking fentanyl
Yeah.
on purpose, but others are really wanting to get marijuana or something else and finding that they like that property and they'll go back to that dealer.
How now you mentioned it's manufactured. People aren't just cooking this up in their bathtubs at home. It does take like a manufacturing facility, right, to create fentanyl.
Yeah.
Bro, what I understand, it's a little bit more complex than the
Uh,
bathrooms that cooked
Right.
up methamphetamine.
right, because that, well, I mean,
Yes.
and I'm talking about like the
Right.
early 2000s, Tuolumne County almost was getting a reputation for having a lot of the, the Walter White style,
Methamphetamine manufacturing.
methamphetamine manufacturing
Mhm.
shacks out in the woods.
Yes.
Now that I think that we're in a significantly better place where that regard it is, but now it seems that fentanyl is coming in to fill the void. Where is it coming from? Where does it originate from?
The illicit market, in particular, right now, what we're finding in California is that we're finding that most of the fentanyl is actually coming from China, and it's being filtered through the cartels in Mexico and then being shipped up in very fascinating ways. They will liquefy it and put it into oil tankers, and give it the appearance of, crude oil, or, having that be transported. We're also seeing a lot of it brought up kind of right into the Southern California Valley and then having it converted into the pills, as Dr. Freeman described.
Mm.
And so that's where we're getting a large portion of it. That's why you'll see a lot of these larger fentanyl busts are coming from the valley locations, because that's where it's traveling as it disperses itself throughout the rest of the state.
Hmm. So there are manufacturing facilities in China that are producing it, and they're producing it specifically for the illicit drug market, and not that, they're producing it for legitimate means and it's being co-opted or something. It's like actually being made to be sent to cartels in Mexico.
Correct.
Okay. How do you stop that? I mean, is that like I mean, it seems like that would be an Interpol type of um, uh, criminal case.
Yeah, so the FBI and several statewide task forces are working on how to combat that. So CHP has a task force. Our local, kind of regional area, including Modesto, has HIDA, which is a federal and state law enforcement task force geared towards, trying to stop the interdiction of illicit drugs internationally. It's hard, but they are putting in a lot of work and effort to try and do that. But it's a tough tide to stem
Yeah,
given the amount that's coming in.
right. Yeah, it just seems like, manufacturing facilities, it's hard to hide something like that.
Hmm.
Whereas, I remember the poppy fields of Afghanistan. That's a much harder thing to stop because you're talking about, tens of millions of acres spread out over a enormous country. But, if we know that XYZ manufacturing locations in a particular country are doing this, like, why can't we stop it?
I think that's a question for our, national level politicians,
Yeah,
really. It's a want and a willingness to engage in the difficult conversations about, trying to adjust the fiscal responsibilities of another country.
yeah,
And how do we do that?
yeah. Do you think that there is enough, are we getting, at the local level, are we getting enough support from our state and federal partners when it comes to drug interdiction?
It's a good question. I mean, I think you have to consider, the holistic approach to, um, the issue of substance abuse. And I think that when we look at the last 2 decades, maybe, there has been a shift away from the enforcement aspect of it
Yeah,
and a greater shift towards trying to, um, help the user and eliminate the market in that way, because it is difficult to stem the tide when you're, coming up against a huge manufacturing, syndicate.
yeah,
And so, is it the level of support that we would want to see and that we think would be effective from a law enforcement perspective? Unlikely, because there just isn't a huge want at our state level, or I think at the national level, to really have a focus on illicit substances in that way.
yeah. It just seems like it's such an incredibly challenging issue to approach from a law enforcement standpoint, because being addicted to a drug is not illegal.
Nobody's
Being an addict is not an illegal activity.
accurate.
But, stealing a car, or, stealing from a relative to support your habit, that is a crime.
Yep.
And so how do you how do you balance that? you know, we know that what's driving a lot of these the criminal activity is the addiction. So it seems that approaching the addiction is the key to this. But there aren't a lot of tools to do that.
There aren't, particularly in Tuolumne County. I mean, when we look at the legislative actions that we've taken as a state in the last decade, particularly when we start with the realignment of 2012 and AB 109, we eliminated a good portion of the tools that we had to help individuals that engage in what is now misdemeanor conduct, but at that time was felonious conduct, for possessing, selling, or engaging in those kind of drug related crimes that you mentioned earlier. And so now we have to assess how do we do that at the community level. And the reality is that the criminal justice system is rarely, if ever, adequately staffed or given the tools necessary to help people overcome addiction. We have a retired judge who once told me, he goes, "Miss Jenecke, if I can be one of the 12 times that I tell somebody to go to a meeting, to stop using, I will do that, because that's how often it takes." And so we have to remember that the effort is a long one. It's an investment in that community member, and we have to give people an opportunity to try to get clean. The problem with that is the accountability piece. And how do we integrate, realizing that somebody has a disease, right? Substance use disorder, and that disease has to be treated as a medical condition, but making sure that we don't allow that to become an excuse for illegal behavior that affects the lives of others. And so it's a really delicate balance,
So if you were to choose, one or two areas where we need to shore up that kind of response, where would it be? I mean, are you looking at, more cops on the street, or we need more inpatient drug rehabilitation centers? Where is the need?
Frankly, I think you've named both just now.
Yeah.
The reality is that when we lost the Tuolumne County narcotics team in 2019, 2018, we lost a huge resource to identify, mitigate, and incarcerate, quite frankly, the individuals that continue to flood the local market with illicit substances. And, in 2019, 2018, fentanyl wasn't what it is now. And so we have individuals who are engaged in our law enforcement community who don't have the training or the current knowledge necessary to really identify what a fentanyl dealer is. And then having access to housing and residential treatment that's focused on getting people clean and getting them into a sober living environment. Yes, we need more of those because we have very few, if any, locally. And that is a resource that Tuolumne County desperately needs. We have a substance abuse problem in Tuolumne County, be it alcohol, opioids, other illicit substances. And that's a problem that we need to address quickly because it is a public safety concern.
Yeah. And I wanted to ask you, Dr. Freeman, because we're talking about, the illicit end of the opioid addiction, but, and correct me if I'm wrong, but it seems like a lot of the people that become addicted to opioids, it starts legally. They have back pain, they go to a doctor, and you're a doctor. What role does or responsibility does the medical community have in kind of the beginnings of this opioid addiction where we find ourselves today?
You're absolutely right. Excuse me. The addiction often starts to opioids, at least as a doctor prescribed item. And there are a lot of reasons why the pendulum swung to the point where we are now, which aren't all doctor fault, but definitely reside on the shoulders of the doctor to fix now. In the early 2000s, the companies that manufacture and are now sued, they lied to the medical community.
Tuolumne County is part of
Correct.
A number of very large national lawsuits
Yeah.
against some of the opioid manufacturers.
Yes.
Yeah.
Purdue Pharma is the one everyone's heard of, but there are others.
They lied to us. I was a medical student at the time, and I wish I would have known then because it's historical, but somebody came into our pharmacology class and told us that if we prescribe for pain, we won't create addicts. I went to UC San Francisco. one of the best schools in the country. And so if myself and my colleagues there are being told this, so were others everywhere else.
Yeah.
Pain became the fifth vital sign.
Right.
So,
And you're talking about that chart where you have the smiley faces, and it goes from a frowny face all the way up to a smiley face.
happy face. Yep.
And that started being used in the late 90s, early 2000s, right along
Right.
with
So
prescribing these
being in
drugs.
pain will not kill you. It's not comfortable. I'm not saying we should have pain we don't need. However, it became the fifth vital sign. So
Yeah.
nurses were asking the patient their pain level at the same time they were taking their blood pressure and their pulse, which if those are off, that will kill you. And they would come back to the doctor to say their pain is a certain level, and if they didn't do that, they were getting in trouble by whomever supervises them. And if the doctor didn't do something about it, they would keep getting bugged with pain still 5, whatever. And so the doctors would make sure that orders were written in a way that the nurses could treat pain, maybe more liberally than we would do now. But at the time, that was the push. In addition to that, there were lawsuits in the 90s against doctors for underprescribing.
Oof.
And so, doctors became more liberal. They thought it wasn't addictive or dangerous, at least. And the right thing to do was to make sure pain was controlled. This was the push. California had 12 hours of continuing education required of us in the early 2000s on pain management, which focused on opioids. So all these things created an environment where we prescribed a lot. We now know that if you're prescribed even just 5 days worth of medication after, say, a surgery or a broken bone, that there's a high chance of becoming addicted, a 5% chance of being addicted a year later, which is a lot, 1 in 20 for normal pain control measures. The push has now been, don't prescribe more than 3 up to 5 days. Used to be common after surgery, get 2 weeks. Very common. That was the right thing to do because patients would complain and then they would sue, and you couldn't underprescribe or you would lose your license. So a lot of things pushed us to where we are, and we are now seeing the effects of that and recognizing that that wasn't cool.
Yeah.
We've created a problem, and a lot of the people that are addicted now, it's not their fault.
So tell me, what are we doing about this in Tuolumne County? What resources are available to people who are facing opioid addiction, and are there any groups that are tackling this as an issue in a holistic way?
So one of the big groups is the Tuolumne County Opioid Safety Coalition, which just got restarted after it initially began in 2010. It kind of fell by the wayside during COVID and what have you. So we have rebranded that, recreated it.
And that's something you've been a key part of for many years, right?
Correct.
Yeah.
So now it's come back into public health, and it's one of our priorities, and we're using some of the opioid litigation funds to fund what it's doing. We're getting any community members, physicians, nurse practitioners, pharmacists, what have you, all together quarterly to talk about the issues and what we can do as a group to help and educate ourselves as well. There are some clinics in town, Matheson, Miwok, the Rural Health Clinic with Adventist all have addiction providers now, which can help people transition off of illicit substances or even transition off of what they've been using for pain to a safer option. We don't have a lot of some of the alternative things that people might have, like, spas that do special things. However, we do have acupuncture in town. We do have providers that are big into other ways to control pain or things that might be ailing people, maybe avoiding surgery, people who do PRP therapy or stem cell therapy. That can be a way to help with pain without some of the more painful operations and what have you. We have, physical therapy is strong in town. We have lots of great people who are doing things. But then there's also the patient who has been used to a long time getting a pill that helps them. And getting these other things done requires some effort.
Yeah.
So, empowering people to seek their own better options for their health is another piece of it.
Yeah. And what advice would you give to somebody that is either facing an addiction issue now, or maybe they're worried about it, or they have a family member that's experiencing addiction? I mean, it's such a devastating and can feel very hopeless when you're in that situation. But what kind of advice would you give to them?
It really is all consuming to be an addict.
Hmm.
There's nothing else that they focus on, and it comes from that dopamine
Hmm.
problem. So a little bit more about dopamine. We function at a level of 50 to 90, 50 to 100 dopamine in our body. It is in our brain wired to be as important as food and water. And when we don't have enough dopamine, we seek it in many ways. There's many ways to get dopamine: exercise and a good diet and crossing things off your to-do list are some of the healthy things to do. But people fill that void with substances, even tobacco,
Hmm.
and getting on that trajectory of even tobacco as being a substance to fill that dopamine is dangerous. Because people will end up doing things that are worse for them
Hmm.
because it's an easy fix. Anyway, once you've been addicted to something, your dopamine levels on a daily basis won't even get up to 40.
Hmm.
And as you're coming off those substances, 10 or 20. So there are things that can be done. Getting into the clinics that help prescribe buprenorphine. Buprenorphine not only is safer as an opiate alternative, but also helps elevate that dopamine. So when people are in recovery, while their body is learning how to recreate that dopamine, they can use that with the prescription of their providers to really get their lives back,
Hmm.
to stop being addicted. It's not necessary to be off of all substances to get your life back and to get into the right trajectory. Being on buprenorphine for a few months to years, some need it forever, but some are very successful at transitioning and improving their lives and improving their dopamine levels and getting to a place of health. And they become the biggest advocates in helping other addicts.
Yeah.
Um, Other things that can be done are, seeking help from your own provider, getting those resources referred for you, and then also having Narcan. If you have an addict in your life, it's really important to have Narcan on hand because that might be what saves them.
Yeah. And Narcan is the aerosol. It's kind of like a aerosol drug that when somebody is overdosing, it takes them out of it, right?
Correct. So it basically blocks the opioid receptors. It kicks off the opioid and fills those opioid receptors. So the opioid creating the problems that it is, the respiratory depression being how they die, it will save them from that. And it's a nasal spray. It is over the counter. Anybody can go buy it from the pharmacist. No questions asked. You don't need a prescription. It is also free for distribution at Matheson. The Red Feather Clinic distributes it. We are working on our plan. We have a plan to get that distributed from public health very soon. And anybody who is prescribed opioids at a certain level or co-prescribed other medications like Valium or Ativan, it's required for the doctors to prescribe it, Narcan for them as well.
Yeah. So, District Attorney Jenecke, I wanted to kind of give you the last word and see. We see these ups and downs in terms of addiction and different trends in terms of addiction and the impacts they have on our community. Where would you say we are right now in Tuolumne County? Are we improving from a law enforcement standpoint, or are things getting worse? Are the challenges just changing? Where are we overall in Tuolumne County right now?
I can't tell you that things are getting better yet. I think that we have the potential for it to get better, at least on the illicit market, once we get some of our law enforcement agencies more staffed. The reality is that we as a community have a substance abuse problem, and we have to start thinking about how to fix that holistically across the entire community, not just in the criminal justice system, not just in the public health realm. And we as a community really have to focus on how do we help our friends and neighbors and family not be addicted. And so we have the potential to be on the upswing, but we're not there yet.
Well, DA Jenecke, thank you very much for your time.
Sir, thank you so much for having
Good
us.
discussion. Thank you, Dr. Freeman.
Thank you. Thanks for having us.
Thank you, and come back anytime. And thank you very much for joining us. We'll see you again next week and talk about more Tuolumne County issues on The Conversation. Take care, everyone.